My name is Dr. Kartik Mani. I'm a radiation oncologist with Stony Brook Medicine. There isn't one particular life experience that inspired my track into medicine. I started actually as a technology guy and ended up in Silicon Valley for a little while. And that experience was fantastic and I learned a lot, but I always felt like I wanted something a little more professionally. And that eventually led me to do cancer research on the East Coast again. And then I decided to double down and become an oncologist. And I've never looked back. I'm one of those unique people that, got lucky and ended up in the right place. Every day I get to work with just amazing people. Oncology, as most of you know, is a big team sport. We always work together and I get to work with these amazing surgeons and medical oncologists and pathologists. And we always come up with a plan that's consensus. We all, sort of have to agree on what's the right thing is. But all the while, that decision ultimately ends up helping the patient and someone you care about and someone you've met and someone you're taking care of. And that's why I love my job. The thing that I want a patient to know about oncology and my field, radiation oncology, is that there is actually a lot to be hopeful about. We are constantly innovating here and we have solutions for a lot of different stages of disease. In my role as a radiation oncologist, I think the biggest thing we're excited about is the increasing use of something called radiosurgery or stereotactic body radiation therapy. This is very, very precise, aggressive doses to tumors without affecting the neighboring tissues much at all. And we can take patients with early stage disease and cure them with just a few sessions of radiation. And now we're seeing this technique being applied more in the advanced setting where we can prolong life and give patients much better quality of life even with very advanced disease. While we can't cure everything, there are a number of cancers we can manage. For instance, diabetes is not a disease we cure, but patients live with diabetes and they lead very meaningful lives and we have to, monitor them and keep an eye on them. But a lot of cancers are actually moving into that paradigm with some of these innovations. Patients can be on certain drugs for a very long time. We can use very focused radiation to take care of spots that are growing. And in that sense, we can offer patients a package that's very unique and it's constantly evolving. So my message to them would be that my role here, if you were coming to see me, is more of a problem solver. I can't perform any miracles, but together we can take that next step in your cancer care.